research topic, that is the comparison of GCL thickness in OCT and waveform on pattern ERG among the glaucoma suspect and healthy control. As we know, the standard automated perimetry is gold standard, but to detect the visual field, there should be at least 25% GCL loss should be there. Nowadays, it has been reported that pre-perimetry glaucoma cases can be assessed structurally by analyzing the GCL thickness of macula by OCT and functionally by pattern ERG. Regarding the pattern ERG, it has been reported that it can detect the defect at the stage of ganglion cell dysfunction, that is the before cell death. So our research question was, can GCL thickness in OCT and waveform in pattern ERG be used to diagnose the pre-perimetry glaucoma? Our primary objective was to compare the GCL thickness on OCT and implicit time and amplitude of P50 and 95 wave on pattern ERG among the glaucoma suspect and control group. Our secondary objective was to evaluate the correlation between GCL thickness and implicit time and amplitude of P50 and 95 wave among glaucoma suspect and healthy control. It was a hospital bed and cross-sectional study. The inclusion criteria was patient of age between 14 to 60 years, and in glaucoma suspect group, the patient having family history of glaucoma, CD ratio more than 0.5, asymmetry more than 0.02, diffuse or focal narrowing or sloping of the disc, but normal visual field or normal IOP, and patient with refractive error should be less than 4 diopter. In control group, we have included patient apparently normal finding. The calculated sample size was 50 in each group. Here we use for OCT, HRE OCT aspect release of Heidelberg, Germany, and for pattern ERG, we use Reti port scan 21 Ronald, Concern, Germany. Regarding the result, the demographic distribution was similar in both the group. This is the unique of this study where we compare the GCL thickness in 2 zones, that is central 3 mm zone and peripheral 6 mm zone. This is the unique of our study. What we found in 3 mm circle zone, there is no significant difference in GCL thickness between glaucoma suspect and control group. But in 6 mm, that is the peripheral goggle thickness at macula, we found the significant decrease of GCL thickness in all quadrants, including the average in glaucoma suspect group in comparison to control group. Regarding the amplitude and implicit time of both wave, we found there is an increased implicit time of both P50 and 95 wave and decreased amplitude, significant decreased amplitude of P50 wave, but non-significant decrease of amplitude of N95 wave. Regarding the correlation between GCL thickness and waveform, at the 3 mm circle zone, we found not any correlation between GCL thickness and waveform in pattern ERG. But at 6 mm circle zone, we found a significant weak positive correlation between the amplitude of P50 wave and GCL, and a weak negative correlation between implicit time of N95 wave and GCL thickness. When we compare our data to the previous reported data regarding the GCL thickness, we found the similar reported by Zhang et al. And Su et al. But the difference is they use GC IPL thickness in comparison to our GCL thickness, and they map the whole macular area where we compare the GCL thickness in 2 circle zones, that is the 3 mm circle zone and 6 mm circle zone, and we found only significant difference in 6 mm circle zone between the glaucoma suspect and control group. Regarding the pattern ERG, the amplitude of P50 wave, we found significant decrease and significant increase of implicit time of P50 wave, similar reported by Jion et al., but Vanek et al. And Zhang et al. Reported no changes between the suspect and control group. Regarding the implicit time of N95 wave, we found non-significant decrease of amplitude and significantly increase of implicit time, similarly reported by the Jion et al., Vanek et al. And Zhang et al. Regarding the correlation, we found there is a very weak positive correlation between the amplitude of both wave to the ganglion cell thickness. But regarding the implicit time, we found a contrast reverse result, that is a weak positive correlation. It should be negative correlation. This is also reported by Zhang et al. So our conclusion is the structurally GCL thickness analysis as peripheral macular region, that is 6 mm circle zone, and functionally by pattern ERG can use to diagnose the perimetry glaucoma. Thank you.
Dr. Anjali, you can get ready in the meanwhile.
So, do you think that PERG would replace OCT, or is it feasible that it will detect glaucoma earlier than?
Yes, recording is very difficult, so it is not commercially available. That's why it is, and it is very time taking. procedure. That's why at present it is very difficult to replace the OCT or visual field at present scenario.
Would you say that PRG is not very easy to do in glaucoma suspects? So if you have OCT, so would you just go for a GCL and not a circumpapillary RNFL in future because this is more sensitive?
I think, ma'am, it should be more sensitive than GCL, but previously reported that both are equal, GCL IPL complex and
But
GCL.
have you compared macular GCC compared to circumpapillary RNFL?
No, previous reported already
been
published.
previously.
There is
Okay.
no significant difference between diagnostic ability of GCL
So
and
what is your take-home message? What is your take-home? What is your conclusion?
my take-home message is that peripheral GCL mapping can help to early diagnose in cases of pre-parametric glaucoma, not central.
Okay.
And the pattern ERG can be used to
Okay.
diagnose.
Okay. Thank you. Can we have
To
the
diagnose
next?
what?
Pre-parametric glaucoma, that is,
See, in this, in this
Can we have the
ERG was
next
not
speaker
affected
on
in
the-
any of your glaucoma suspect. And usually only the N95 amplitude is usually affected. In your case, all the implicit times are also affected. Can you explain why? None of the studies have shown
Yes,
any association with
ideally
either
there's- yes.
P50 or implicit times.
yes, sir.
Yours-
Okay.
Yeah, yeah.
Ideally, there should be only N95 should be decreased in comparison to P50 amplitude. But in severe cases or some cases, it has been reported that both can be reduced.